now we're moving on to item 6E, which is discussion and possible action, including acceptance of presentation by the Childhood Trauma Action Team of Mendocino County on Adverse Childhood Experiences, ACES. So Supervisor Brown is the sponsor of this.
Yes, I am, and with the proclamation, we received some good information, but it is an honor to have all of you here to be able to tell us more about ACES and the occurrences in early stages of a child's life and the negative effect it can have on them throughout their entire lifetime. So I'm excited to have you here, and please go forward with your presentation.
Hello, thank you again. My name is Roseanne Ibarra, Executive Director for First 5 Mendocino, and I have Julie Featherston here from Healthy Mendocino. She's also an integral part of the work we're doing, and Sharon Hildebrand, who is our chair. So I'm here today as wearing my First 5 hat, but also wearing my hat as a member of the Policy Council on Children and Youth. And so this presentation today is from the Childhood Trauma Action Team, which is a subcommittee of PCCY, the Policy Council on Children and Youth. So Julie and I will be discussing the work that the CTAC group, the Childhood Trauma Action Team, has been doing, and then also we'll be providing an overview of adverse childhood experiences. We will discuss how this presents in our community, and we will also discuss what we can do about it. In thinking about the work that the Childhood Trauma Action Team does, our vision is that all children will have the support and opportunity to grow up in stable and supportive families, and families will have access to support in times of need. Over the last 10 months, the CTAT group has been refining our approach and how we address the work, how we address adverse childhood experiences in Mendocino County. We've created a detailed work plan that will be working on coordinating our strategic plan. So at this table, we have a number of different child advocates represented. So coordinating our strategic plans from our agencies, coordinating our investments. So looking at the money that we put towards this work and also our staff time. And then coming to this table to jointly review and redirect our work as needed as we move through the year. So what we're finding is that there's a lot of good work happening in Mendocino County, and we're so busy doing the work that we oftentimes don't get an opportunity to kind of reach across the aisle and to do collaborative work. So we find that oftentimes we're siloed. So making sure that we're using a common language and making sure that our work is complementary to those of our partner agencies, and that it links up, and that it's also addressing the spectrum of need across the ages from 0 to 24. So you'll be hearing today that the ACES work is complex. There's a number of different facets to it, from looking at the individual themselves, the family unit, the broader community, the time that before trauma happens, the trauma itself, and then post-trauma. The other layers include the service delivery and how entities prevent and respond to trauma. I would say that each of us, each community member, each agency, each elected, holds a piece of this work, even if we aren't proximate to the issue. The CTAC group consists of 14 child advocates, and just to name a few, we have Tapestry, Mendocino County Youth Project, the Mendocino County Office of Education, SPACE, Hopland Band of Pomo Indians, Adventist Health, Mendocino Community Health Clinics, and our County Family and Children Services, the Community Outreach Unit, and our Maternal, Child, and Adolescent Health. Our goals are to support family resource centers in the county through sustainable funding. We also support the continued collaboration between public and private entities. We advocate for the commitment of a defined percentage of the local cannabis tax to support children and families. And we also, anytime that there's a policy matter, to consider the impact on Mendocino County's children and families. So the strategies that we use to achieve these goals, we've been working to educate the community on adverse childhood experiences, trauma and resilience, and the 5 protective factors. So those factors are parental resilience, social connections, knowledge of parenting and child development, concrete support in times of need, social and emotional competence of children. So we really find that it's important that children have positive interactions and that they have the ability to self-regulate and to effectively communicate their feelings. And our second strategy is to advocate for more funding for prevention. And the third strategy is to advocate for ACES screening. So there was a legislation that was passed and it became effective January 1st where providers can conduct ACES screenings and be compensated for that. So that's through Medi-Cal. And so we've been doing, our attention has really been focused on that. And making sure that providers are prepared to administer these screenings, but also that community-based organizations are prepared to receive the referrals that they'll be getting. Part of this work, we've been more intentional about how we're designing our training calendars as well. A number of the advocates have training dollars, and so making sure that our trainings build off of each other and truly meet the needs in Mendocino County. This month, the County Office of Education will be hosting Reframe Your Brain on Saturday. I'm sorry, not this month. This is going to be Saturday, February 1st. And so that conference is for educators to learn how they can support students that have experienced trauma. CASA, who is also part of our group, created a coping skills toolbox and delivered it to every school as of December. We will be working on creating a map of trauma and resilience services in the county, and also identifying different access points for families. And the purpose is we want to identify gaps and also identify how service providers can better coordinate across the various systems that are involved. And we're finding that a lot of community members and agencies even, I would say, are not aware of what all is available in the county. So we want to make something that's going to be internal for our purposes and planning, but then also make a product that's useful for the general public. And so now I'll invite Julie up to discuss adverse childhood experiences.
Thank you all for having us today. I'm Julie Featherston. And I think the thing about ACES that brought us here is not only the prevalence in our county and the effects, but the science that has come in the last 5 to 10 years about how it changes the brain and how it impacts social, emotional, physical health, lifespan, a range of things that we'll be talking about in this. We wanted to give you an overview, a little TED Talk that Nadine Burke-Harris, who is now our Surgeon General for the state of California, gave in 2015, and it really does a great job of summing up some of this, and then we'll go into a few more details. So let's see if I can remember how to.
Exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or packaging chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California, and together we opened a clinic in Bayview Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle, and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, Dr. Burke, have you seen this? In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand, better than we ever have before, how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive
to that video and to any other information that you might want after we're done. So again, what are adverse childhood experiences? They're physical, emotional, sexual abuse, physical and emotional neglect, and then household dysfunction like mental illness, incarcerated behavior, substance abuse. These are the things that we see over and over again identified as high priorities in our county when we do community health needs assessments. And the county itself spends millions of dollars, I would say, although I haven't done the analysis directly, on substance use disorder treatment, opioid, the Safer RX Coalition, direct response to domestic violence, mental illness. And so this is a real cost to our county, not just in dollars, but in human capital as well. So the thing I think that most people don't really take home with them is that this isn't just a behavioral issue. It actually changes the physical structure of your brain, your nervous system, and even your DNA. And those changes in your DNA can be passed on for up to 3 generations. So if I were to experience adverse childhood events and those changes happen in my brain and body, even if my children did not, I'm still passing it on, not through behavior, but through my genes. So it's a long-lasting impact. She mentioned some of the increased, sorry, I need my glasses. Some of the increased risks, and I just wanted to highlight a few of those. They talk about 12 times the suicide rate. The Mendocino County rate of suicide is 21.3 out of 100,000, which is more than twice of California. So in a lot of our indicators, and I was here a couple months ago talking to you about child abuse in the foster parent and adoption month. A lot of our indicators are over double of California. This is just an ongoing issue for us in substance abuse, child abuse. So it's not surprising when we're talking about injected drug use that it's 10.3 times as likely to use injected drugs if you've had 4 or more childhood adverse experiences. Well, our rate in Mendocino County is 21.3 per 100,000 deaths from heroin overdose. This is directly related to ACEs. And I can go on and on. I'm happy to share more data with you in general if you would like it. So how are we seeing this in your communities, in our communities? So I was hoping that maybe we could just do a little popcorn style of some of the largest health issues in your districts that you're seeing that are human, so mental illness or drug abuse.
Substance abuse, poor diet, lack of exercise.
Yeah. Anybody else?
Substance abuse.
I have to agree.
Substance abuse. Yeah. So again, 7.3 times, I believe, is the increased rate of substance abuse if you have had 4 or more adverse childhood experiences. So you're seeing this in the direct impact of adverse childhood experiences in your communities, and each of them. And the cost, I believe that in your packet you have this overview sheet on the cost of child abuse to Mendocino County and the adverse childhood experiences. And sorry. Thank you. $5.1 million. Is that? I'm sorry, I didn't pull out the right thing. So we're talking about higher healthcare costs, increased incarceration rates, lower education achievement, impacts on mental health outcomes, and challenges to achieving self-sufficiency. Does this sound familiar? When we talk about homelessness, which is a big issue we continue to talk about and struggle with how to impact effectively, in some populations they've seen as many as 86% of homeless individuals have up to 8 ACEs or more. 10 times likely to have physical abuse in their household in those ACEs. And in San Jose, 66% of the homeless have 5 or more ACEs in the homeless population. So even those things that we don't think have anything to do with adverse childhood experiences, like obesity, you said diet and exercise. When they originally did this study, they did it because they were finding that in obese adults, they did treatment and they would lose weight and then they would gain it back. And when the doctor started asking more questions, what they found was sexual abuse history in their childhood. And that's why they originally did the study. So it's an impact that goes to your local resources and the cost. So you're also the largest employer in Mendocino County, and how does this impact your staff? Because it's not just in mental health or physical health, but it's also been shown in several studies that it affects job problems, financial problems, and absenteeism in the workforce. And it is also still a dose-dependent relationship, which means the more ACEs you've experienced, the more you tend to have these problems on a frequent basis. So how much is this costing you in lost productivity, health, and injury claims? It would be interesting to know. There's increased rates in clinical depression, 2 times likely to have diabetes, 2.3 times likely to report poor health. So missed days of work, lower performance, less employee engagement.
Hey, Julie?
Yes.
Supervisor Williams has a question.
Yeah, in your previous slide, you don't need to back up. What is the trend in our county? Are we improving? Are we getting worse? Is it stagnant?
The trend in ACEs?
Yeah, and I know the methodology has changed over the years, but I mean, if we were to look the last decade or if we were to look generationally, are we better or worse?
Well, we actually have only recently began to a screen for ACEs in
Yeah.
Mendocino County, and we have very limited data on that. But when we look at the indicators of the impacts, like mental health, child abuse, pretty much most of those indicators, and I'm going to defer to you guys, have been consistently going, what's the word, worse, or at least remaining the same over generations. Right? Is there anything you can think of? Yeah, no, there's not anything I can think of.
And do you see that trend continuing?
I do, because it's a matter of how do we address this from a prevention point of view. Like if you address the downstream effects, then the cost, it's like 3 times the cost to address the outcome. If you start to back it up and look at, for example, triple P parenting, when you're in a family in crisis that's having an issue, and if you bring resources to that family with small children before their brains start to develop these patterns and they've already had negative health outcomes, you're really saving money and creating both capital and human reserve in that process. And I think that's why one of our strategies is to ask for more prevention dollars in this area. Does that answer your question? And I'm going to, so let's talk about prevention for just a moment. When we think about prevention, obviously, I mean, sometimes we talk about how do we stop it from happening, and maybe that'll be asking families to go into a court-ordered or differential response counseling or the other kind of support. But we rarely think about really going back up to the children at the earliest stage and before the violence or behavior occurs, and working on providing the supports, information, education, protective factors that we would need to prevent it from happening in the first place. And as I said, since it goes for 3 generations, this is a really important piece to be able to stop childhood trauma from having collateral damage through the generations. So there's 3 kinds of prevention: primary, secondary, and tertiary. And we really want to move upstream as much as possible to that primary prevention, again, to create financial and capital savings, human capital savings. And I'm going to turn it back over to Roseanne.
Thank you, Julie. So what can be done about ACEs? So on this slide, you'll see that home visiting is one of the items that listed in here in Mendocino County. We do have home visiting. We have Healthy Families America that was launched approximately 2 years ago. There's parenting training programs that are also listed, and here in Mendocino County, we have Positive Parenting Program. Intimate partner violence prevention, we have Project Sanctuary. Social supports for parents, programs for teens. We have family resource centers that for that. I know that the Behavioral Health Department, our Behavioral Health Board, and the Measure B Group, and also Fort Street have been doing a lot of good work on mental illness and substance abuse treatment. And then also listed on here, you'll see that there's preschool enrichment, and then a mention about assistance for families. And we need more preschools and childcare, and of course, sufficient income for families here in Mendocino County. And it's fantastic that we have these programs in place, and we need to do more to support them. You'll also see listed here that safe, stable, and nurturing relationships are essential. How are we ensuring safe, stable, and nurturing relationships is the question. We as leaders and service providers, are we modeling this for our families and children, and how we work together and how we provide services? In my opinion, this really comes down to the fundamental question of what are we doing to build our human reserves? We often talk a lot about fiscal reserves. I would say human reserves are just as important. I know as our county leaders, you're working hard to ensure responsible stewardship of our financial and natural resources, but I also I want us to think about how are we addressing the human ones. So when we consider the current landscape, Governor Newsom has been prioritizing young children. His budget puts forward $2 billion for early learning and healthcare. He has a 2-generation strategy that's been proposed to invest in parents so that they can in turn invest in their children. The state's currently working on the creation of a master plan for early learning and care. And Governor Newsom appointed our very first Surgeon General, Dr. Nadine Burke-Harris, who you heard from on the video. Dr. Harris is a champion for ACES, and both at the state and federal level, funds are being directed towards ACES work. The legislature passed legislation, as we've been discussing, that's going to be compensating providers to do ACES screenings, and that's effective January 1st. So in thinking about what can we do about this issue, you're part of the solution. All of us are part of the solution. To think how different our communities would be if individuals had the appropriate intervention and resources they needed when they were children. What would their quality of life be like now? From what I've seen as an agency person, we are reactive here in Mendocino County. We need to be more proactive. All of us are working to enhance the quality of life for those here in Mendocino County. And to do that, we need to hear directly from the communities we serve. Is it possible for supervisors to host fireside chats, town halls in your districts on issues related to children and families? This would go a long way to help the Policy Council on Children and Youth and our Childhood Trauma Action Team with the work we're doing. Your presence and attention are critical to advancing our work. Is it possible for leadership to embed children, youth, and older adults into your plans so that all Mendocino County children, youth, and older adults are protected from neglect and abuse? Would it be possible for leadership to prioritize upstream investments to build our human reserves? Governor Newsom said, every child in our state should have the resources and support they need to live happy and healthy lives. Here in Mendocino County, the child advocates need your help to address ACEs and to make sure children and families have what they need. Thank you so much for your time today, and I invite Sharon Hildebrand, our chair, to come up. There are packets that were distributed to you, and she was just going to go over briefly what's included in your packets.
Thank you, Roseanne, and thank you to our Board of Supervisors and support staff. My name is Sharon Hildebrand. I'm the director of CASA, which is Court-Appointed Special Advocates of Lake and Mendocino County. I'm also the chair for the Childhood Trauma Action Team, but we really, I just do all the copying and make the agenda. We really are a collaborative committee, and we're a grassroots committee that does a lot of the prevention and education in the community for Policy Council on Children and Youth, which by statute is our county designated policy and child abuse prevention council. So every county has to have a child abuse prevention council. Put that back together. Oh, well. And you're probably wondering, what does all this mean? This is an explanation as opposed to an excuse of why our county is having to spend a lot of money on child abuse prevention, child abuse intervention, mental health, substance abuse, incarceration, juvenile incarceration, and further down the line. And so trying to bring awareness to what is causing this, an explanation, it should be able to help you develop prevention plans and strategic plans. And so when we were talking about giving this presentation to you, and we've always come in front of you and talked about child abuse prevention in our county, one of the things that we want to support our county is building a strategic plan that every single time defines as a priority children and families. If we forget to consider supporting what is building and rebuilding our community on a generation-to-generation basis, we're not going to put in place a healthy county going forward for our children. So in your packets, on the left side of the packet, there is an example of an existing strategic plan. This one happens to be from San Diego County, because you know what? We're all into, instead of rebuilding things, if we can borrow and build on that to make our county better, why not? Then we don't have to start fresh. So this defines the strategic plan under the Living Safely as one of the goals of all San Diego children, youth, and older adults are protected from neglect and abuse.
Okay, just 1 second.
Yes.
Supervisor Brown.
Thank you. And I would say, and now I see it in my packet, that on our legislative platform,
Yeah.
the policy statement on marijuana and youth that you brought forward 2 years ago or so?
3 years ago.
In 3 years is attached.
Yes, I did put that in there. And the idea is that, and that's important, she brings it up, I gave you the copy that our policy council recommended for your legislative platform with regards to youth and marijuana. Supervisor Williams asked, where are we going? We're going the wrong way as to statistics, as to our county. Some may say, is that because we're becoming more aware of reporting? Absolutely. Is that because we're putting a name to it? Absolutely. That doesn't mean that we can't look at the trend and try to put a stop to it by putting in place opportunities. And one of the biggest opportunities is bringing services to your districts within your districts. Those are your family resource centers. We need to sustain those family resource centers. At the same time, also build infrastructure within each of them to bring the considerable services to each of those family resource centers. So again, on your left, you have a lot of legislative information, okay? There's also a...
Thank you, Carla. I was going to take mine off and take it down there. I didn't know what happened to it.
On electronics. One of the documents on the left-hand side is an Assembly Bill 2083, which was supposed to have been taken effect January 1st. It is Trauma-Informed System of Care Summary. We as a county are obligated to put some MOUs together. I believe we have until fiscal year 7-1 to complete that. It speaks to exactly what we spoke to today, was what is in place for our system of care to meet the obligations of that Assembly Bill. Also, I put some briefs in there, and then in the back is Preventing Adverse Childhood Experience. It actually looks at opportunities to leverage best available community practices, okay? On the other side, you have your, the second one is you may be curious about what your ACE score is, okay? You can take the little test, and on the back of it is a resiliency score. I would suggest to you that many in this room and have ACEs. It could be 1, it could be 10, but opportunity exists in resiliency, which is what we talked about, the protective factors, and that's on the back. So make sure to take that score and look at that, what we are missing out on some of our supports for our families. Building community resilience, you're looking at our adverse childhood experiences. Nationally, we have children with two or more ACEs. Nationally, it's 21.7%. California, it's 17%. Mendocino County is 31%. All right? It also goes into our domestic violence rates, our child mortality rates. We are almost twice the state average on child mortality. I do sit on the Child Death Review Committee. There's a lot of work that we have to do for prevention opportunities to make sure our children are not dying at twice the rate in the state of California. Also in your packet, it's a study, Economics of Child Abuse. This is a study specific to Mendocino County. This is what you as county government have to work with ultimately is how do we fund programs? It is astonishing how much the adverse childhood experiences, which then move forward in adulthood, are costing our county. So there's also a very detailed document that tells how this study was derived, okay? We also have some more resources that I've given you, and then there is a quick sheet on stress and early brain growth. So as a moving forward, we want you to understand and to start talking about this in your districts. We're willing to help you. So we would like to schedule, before the end of this fiscal year, fireside chats in your communities that are focused on children and families. It can be an hour chat. We will designate a point person in every single district where you decide to have them. We're happy to send information. We do trainings that are free. Mandated reporter trainings we do free. Many of our trainings are Triple P trainings, which we have a lot of them right now, this fiscal year planned, free, okay? We have an early childhood mental health training, part 3 coming up, which is part of a state study which the ACES directive to our pediatrics and our clinics for the ACES mandate to start January 1st, free. So those can all be looked at on Healthy Mendocino, and we encourage you to ask questions, okay? I just attended Beyond the Bench, which is held every 2 years for our child dependency delinquency. It's through the juvenile courts in San Diego, and Nadine Burke spoke to, there was over 2,000 people attending. It was refreshing when she asked, how many of you know what ACEs are? It was refreshing to see greater than 75% of the room dead. So this is something that has been made a priority in the state of California, and we want to make it a priority in Mendocino County to understand it, because to understand it is to prevent it. Thanks.
Sharon, we have a question here.
Yes.
Supervisor Williams.
Is county government doing its part today?
In what way?
Well, are we making a difference? Have we stepped up? Are we providing what needs to be provided
You know
to
what?
change the trend?
I think that you could probably ask 15 different people in this room, and we're all going to have a different opinion.
What's your answer?
But my answer is that can we do more? Yes, we can all do more. And I would suggest that sustaining it through sustainable funding through our family resource centers and further development in where our families are is the most important thing. We don't have a good transportation infrastructure. People can't get to Ukiah for services. We have to take it to them. Okay.
I'll take you up on the help with the
Thank you.
fireside chat.
Absolutely.
But I think it would be beneficial as we talk about building a strategic plan in the coming months to get an understanding of other rural counties that have made a difference, that have a good trajectory. What are they doing so that we can borrow some ideas and look at what it'll cost, because we need to get those costs into
Absolutely.
our long term.
I'm happy to get that for you. One of the things is the requests that we have brought in front of informational-wise, although I will say that you and Supervisor Hashek may not know about it, is we have made requests through a 20 by 20 to defer some of the marijuana tax to children and families through sustainability programs in each district.
Thank you.
Thank you.
Supervisor McCowan.
Thank you, Mr. Chair, and I very much appreciate your answer. Instead of, it's very easy to be critical. I really
Yeah.
like the answer, we can always do more. Because wherever we are on the scale, we can always do more.
Absolutely.
And I do think the family resource centers are critical. And in the past, I've advocated for additional funding for the family resource centers. And something that all of you might put together for us, what are specific needs of the family resource centers that aren't being met
We can do that.
currently?
We will do that for you.
And
Absolutely.
again, we're in this situation, we have many critical needs, the demand for which greatly exceeds the resources, but it's still going to be helpful to have a clear picture of specifically exactly what is the critical need and what should we be trying to meet.
Absolutely. Thank you.
Thank you.
Supervisor Jordy.
I just want to say that I'd be happy to be part of a workshop on the coast.
Excellent.
But before that, I'd like to meet with your group and try to understand what's going to be presented, because I think in addition to identifying problems, I think we need to identify solutions, because otherwise people go away hopeless.
Absolutely. The rule is we can't complain unless we have a solution. So, yes, we can always do more. Absolutely.
Supervisor Brown.
Thank you, and Dr. Burke spoke, was one of the keynote speakers at CSAC first week in December, and there was also a speaker at the Health and Human Services Policy Committee, so at CSAC.
Yeah.
So it's a big issue, and they're beginning to look at it all over the
Understanding,
state.
right, understanding it. Our schools, we sent millions of dollars out of this community because our children who may have been identified as ADHD really have post-traumatic stress disorder, okay? So at one point, because their behaviors far exceed what our educators can handle in our schools, and we also have to look at the impact on our other youth in those schools, we need to send them out of county to what's called a non-public school. We do not have one in this county. I would highly encourage that. That's a way to save a lot of money by developing a trauma-informed environment for us to serve these children. Thank you.
Okay. Thank you all very much for the presentation and great information. Count me in too for the fireside chat.
We will contact you.
Right.
We'll hold you to it.
Is there any public comment? Ann, you're up.
Thank you. Ann Mulgard. Let's go with chairperson of the Ukiah Unified School Board. So Mendocino was way ahead of the game. In 2005, we brought Dr. Vince Folletti, the creator of the ACES study out of Kaiser, here to Mendocino County. I believe Supervisors McCowan and not a supervisor yet, but Carrie Brown were both at the Ukiah meeting, and our representatives in Fort Bragg were at the Fort Bragg site as well. And we talked about it, and I think the big difference between 2005 and today is what you brought out is, are there solutions? Because at the beginning, we were just thinking about how many ACEs do you have, and then it stopped. Now, the good news is we know from the research that just recognizing how many ACEs you have helps you and puts you ahead and helps you to start on that road to recovery. But what we also know is the flip side of that page, which is all about the resiliency factors. And we know what they are. They're really good parenting. They're parents who know themselves before they have children. They're having the right needs met in times of emergency, which family resource centers do. It's having support at the beginning, which home visiting does, which is provided now through our public health department. And the other key difference that we know now that we didn't know in 2005 when we started all this ACEs talk is that we have a governor who has put a lot of money and emphasis into this, which means fiscal leveraging opportunities. Because I know you don't have any more money now than you did in 2005 to spare. And one of the great skills of Tammy Moss Chandler, your Health and Human Services Director, is the ability to leverage that funding. And so that is going to be something that you can look for over the next couple of years and ask questions about and make sure that the support is there to leverage what we can. By Governor Newsom appointing both the new Surgeon General and a Director of Early Childhood Development, both two new positions that never existed before, that is a whole new ballgame. And so that's what I think is hopeful this time, whereas before it was more trying to rob Peter to pay Paul. But I think there really are a lot of new funding opportunities this time that have never been there before. So thank you.
Thank you.
Thank you. I know it's late in the day, but I appreciate the opportunity to comment. Tammy Moss Chandler, your Director of Health and Human Services. I just want to add on to what Ann Mulgard just said about this strategic time in the state of California and here locally, and for this information to come to you really at the cusp of you putting together your Mendocino County strategic plan and the role of prevention in putting children first in Mendocino County. And I love the example of San Diego that was given in the packet to you today. Certainly, you have many county employees here who partnered with San Diego on much of this strategic planning, public health prevention work, and would look forward to continuing to work with our community partners and the board on these efforts. I also just want to take this moment to let you know about the really rich trauma-informed workforce development that is happening. You heard about a couple of the community-based trainings. This has been a key goal in workforce development within Mendocino County and across the state in health and human services. And it's not just, as you heard today, about interventions and prevention with children as a highest priority, but also that you are the largest employer in Mendocino County. And we actually are working diligently around interventions and supports for our own employees who experience secondary trauma every day in the work they do to serve community and to provide intervention services here, whether it's through home visiting, through child welfare services, and through other partnerships. And they're often our most resilient survivors of trauma in our community as well as they serve our public. So we are really excited to be moving forward into 2020 with more emphasis on trauma-informed care and trauma-informed supports for our own employees as we look at our workforce development. Finally, I just want to make sure that you know that you had a host of team members within the county system who were at some of the same events that you heard about today, whether it was Beyond the Bench, where your probation chief is here today. He sent a team of your social services employees, our social services director, our child welfare director, many of our key leaders in child welfare were at that statewide event with our community partners to bring forward these new strategies, and the MOU you heard about in AB 2083 is well on its way based on those partnerships that exist in the county today. And finally, I just want to thank the board for hearing this, for taking the time to focus on ACES and this really important work that's happening around the country, around the state, and here in Mendocino County. We are the largest funder of the Family Resource Centers in Mendocino County through your board's budget process, and we'll continue to work with you on other solutions and strategies.
Thank you. Okay, any other public comments? Okay, any comments from the board? All right, with that, I think we're gonna adjourn at 5:05.